Hi there, Paul Haas, physiotherapist. Welcome to another edition of Gripit Active K-Tape video education tutorials. Okay, today we are going to go through the technique for the tennis elbow, commonly called lateral epicondylosis, tennis elbow, what else? Tendonitis, and this could be applied to a number of regions of the body, and again, all our applications are based on thinking clinically. But this is a very straightforward method to show you how to tape for that common tennis elbow problem, which is a problem with this common extensor origin here, which is basically a combination of tendons, which is why it's called a common tendon, get inflamed around the insertion or just above the radial head. That's a very common pressure area of this tendinosis or tendonitis. The Gripit Active tape we love because it's designed to change the mechanics of the body. It's not designed like the kinesiology tape to change the fascia. It's designed for the mechanics. And you can see here with the Gripit Active, that bungee effect, which is really, really cool, which means that energy that normally goes through our tendons and muscles and bones is taken into the tape partially. And then that energy has to come back out with a recoil effect, which means you get assistance with motion. So it's a really, really great product, guys. Okay, so with Daniel here, just popped in from footy training to go through a little taping technique with me. We're going to talk and show you this technique today. Okay, so what's really important is that you use the advantage of the extensibility of the tape. Now, just as a quick demo, I'm going to show you two different ways to do the main longitudinal taping arm here of the Gripit Active. So I generally ask the athlete or patient to put their wrist into extension. Yep, that's right. And then Daniel holds that, and then you extend the tape. So Daniel, we extend the tape here, get a real good pull of the tape. So you'll see all this, effectively this bow here, you've got this area here, so it's under massive tension, and you lay that down, okay? So that's one way we can do this taping technique. And then from there, I just asked Daniel to hold that in that position, okay? And then I'll just cut off another strip. We've got our flesh color here. We've got a few colors in the range, and more are coming. And so with I call this our support band. And the support band is just designed to basically do how it's stated is it's designed to support that other tape, because this is effectively, there's parts of the body called a retinaculum, which holds the tendons down, and this is just like that retinaculum. It's designed to hold down this tape because it's under massive tension. And so if Daniel just lets go there, so you can see here that this tape is already under tension, and as Daniel drops his wrist, he'll feel that tape really wind up and stops that motion occurring, which means these tendons get a break. So that's one way we can do that, but I just want to show you another way today that's really cool, that really works on someone who might keep this tape on for an extended period of time, which means that this anchor point might need to be a little bit stronger. So let's show you that quickly. Okay, so just round off our edges, really important so it doesn't get sort of scuffed against, if your clothes or if your fingernail or something hits the edge, sometimes it's a bit easier, it can come off. So what I'm going to do, watch me here guys, just getting close here. So these little diamonds you make are where the fingers are going to slip through so that we can create a really good lock of our tape. Okay, so what I do here, everyone does it a bit different, but I generally cut the tape, tear the tape above and below the diamonds, okay? And so what we're going to do here, so Daniel's going to open up his fingers for me. So you can choose to go wherever you want, and I don't have the 7.5 today, we're using the 5 centimeter. You definitely could use the 7.5, and you pass this through the fingers, okay, like that. And so we just peel the backing paper off here, and there our anchor comes into the palmar aspect of the hand. This is called the dorsal aspect of the hand and wrist and arm, okay? So we lock down our anchor there. And you can see now we've got this awesome, real strong anchor here. All right, so extend the tape. Now we get Daniel again to arch, that's it. Now this time I will ask him again just to hold that down a bit there. So just grab that, buddy. Yep, awesome, okay. And so again, really, really strong tension here. Okay, so now I'm just going to hold that there. Yep, hold your wrist up. So while he holds his wrist up, we really start to plant down and work the tape into the skin and get that nice and sticky. Keep your wrist there, buddy. Okay, and from there, we grab our tape, and this one's just slipped back in the box. So we put our support band across the wrist to hold the tape in place. Remember I said like a retinaculum? Okay, so we lay that over the proximal crease there. Okay, and so the effect of that, and just let go of that now, buddy. So what will happen now is that as Daniel drops his wrist, he feels that, you'll feel that, mate, yeah. So what happens is that normally when the wrist drops, these muscles work really hard to eccentrically lower the wrist. But what Daniel now will find happens is that rather than these working eccentrically, which is just a technical term for a muscle contracting while lengthening, the muscles underneath actually work to drop his wrist, which means these guys get a break, which guess what means that the tendon insertion gets a break, okay? So that's really important. Now, that may be all you do for this as a way of deloading the common extensor origin or tendonitis, but let's quickly show you how to then stop a secondary motion, which is called pronation. And so with pronation, we start to sort of get these sort of compression tendinopathies around this radial head. Okay, so we want to try and really, if this is for that real grumbly tendon that just really needs time off when the athlete or the patient is just consistently back at work or back playing and they need to offload that area. Okay, so what we need to do here, we need to put the wrist and the arm into a supinated position. That's it. So you hold that there, mate. Okay, and then we're going to wind up the tape under tension. So basically, Daniel will always want to come back into a supinated position, which is a better position for these tendinopathies. And he'll feel this any second now once I apply the tape. All right, so we'll just get our end going here. Okay, so you can anchor here. Okay, and so I'll just set up this tape here. So again, we're going to really wind him up here. So you can see I've got about, it's a fair bit of stretch there. Okay, and this anchor point can go to where I'm applying it now. If it goes a bit further up, it doesn't really matter. As long as if it goes a bit further up, it starts to affect the elbow motion. So probably in that respect, we don't go too much further. But we're starting on a spiral from here around to the back of the medial epicondyle of the elbow. So now, if Daniel starts to rotate his wrist around, he'll feel that's quite hard to do, and it feels like it naturally wants to fling back, which means that by the tape avoiding the movements of pronation and wrist flexion, which puts stress under these structures, this is completely offloaded. So lack of involvement of these muscles, which means lack of stress of the tendon, which means that your tendinosis or tendonitis has a chance to have a break. So you still do your exercises to relieve this problem, but it's very good for people who are still playing or who are still working. So, because we talk about tendons do like some form of load, but that's controlled load. Erratic load like at work and at footy or tennis or basketball isn't good load. And so this is your chance to unload it. We've got 2 moment arms that we're trying to deload. It's an awesome technique. It's for anyone from patients to athletes to whatever. Give it a try, and we'll see you for the next version of Gripit Active K-Tape.
Now we step into the dark.